CCMA NHA Exam 2026. Question 1. A clinical medical assistant is preparing a patient for an ECG. The patient reports experiencing occasional chest pain, which they describe as a stabbing sensation that radiates to their left arm. What is the most appropriate initial action for the medical assistant to take? Administer a sublingual nitroglycerin tablet as prescribed. Reassure the patient that chest pain is common before an ECG and proceed with the test. Immediately inform the physician of the patient's symptoms before proceeding. Position the patient in a supine position and apply the electrodes for the ECG. Radiating chest pain suggests a potentially serious cardiac event requiring immediate physician evaluation before any routine procedure. Medical assistants are not authorized to diagnose or administer medication without direct physician order during an acute event. Patient safety and escalating critical symptoms to a licensed practitioner are primary responsibilities. Question 2. A patient with a history of diabetes mellitus comes in for a routine follow-up. The medical assistant notes that the patient's blood pressure is 150/90 mmHg. The patient states they feel fine. Which of the following is the most appropriate next step? Document the reading and inform the patient that it is slightly elevated. Recheck the blood pressure after a few minutes, ensuring proper cuff size and technique. Advise the patient to schedule an appointment with a cardiologist immediately. Instruct the patient to reduce their sodium intake and increase exercise. Factors like improper cuff size, patient anxiety, or movement can cause transient BP elevation. Rechecking using correct technique is essential before taking further action. Jumping to conclusions or giving medical advice falls outside the CCMA's scope of practice. Question 3. A medical assistant is preparing to administer an intramuscular injection to an adult patient. The medication insert specifies a needle gauge of 22G to 25G and a length of 1.5 inches. Which of the following needle and site combinations would be least appropriate for this injection? 23G 1.5-inch needle in the vastus lateralis, 22G 1-inch needle in the deltoid, 25G 0.5-inch needle in the ventrogluteal, 24G 1.5-inch needle in the dorsogluteal. A 0.5-inch needle is generally too short for an IM injection in an adult as it may not reach the muscle layer. While 25G is an acceptable gauge, the length is the primary issue since IM injections typically require at least a 1-inch needle for adults to ensure medication reaches the muscle. Question 4. A medical assistant is performing a venipuncture. The patient suddenly becomes pale, diaphoretic, and reports feeling lightheaded. What is the immediate priority for the medical assistant? Complete the blood draw as quickly as possible to minimize discomfort. Offer the patient a glass of water and tell them to take deep breaths. Withdraw the needle immediately, lay the patient down, and elevate their feet. Administer ammonia inhalants to revive the patient. Symptoms like pallor, diaphoresis, and lightheadedness suggest a vasovagal reaction where the patient might faint. The immediate priority is to prevent injury by withdrawing the needle and positioning the patient supine with feet elevated to restore blood flow to the brain. Preventing a fall is critical. Question 5. A patient calls the clinic requesting a refill for a Schedule II controlled substance. The medical assistant notes that the patient's last visit was 6 months ago and their prescription ran out last week. What is the most appropriate response? Inform the patient that the prescription will be sent to their pharmacy immediately. Tell the patient they need to schedule an appointment with the physician for a refill. Advise the patient to go to an urgent care clinic for a refill due to the delay. Instruct the patient to pick up a written prescription from the clinic later today. Schedule II controlled substances have strict regulations requiring a new written prescription after an in-person evaluation. With a 6-month lapse since the last visit, proper patient assessment and adherence to legal requirements are necessary to prevent misuse. Question 6. A medical assistant is preparing to clean a spill of blood on the examination room floor. Which of the following personal protective equipment, PPE, should the medical assistant don at a minimum? Disposable gown, gloves, and a face shield. Utility gloves, surgical mask, and shoe covers. Disposable gloves and a face shield. Disposable gloves only. When cleaning a blood spill, there is risk of contact with blood through direct skin contact or splashes to mucous membranes. Disposable gloves protect hands, and a face shield protects eyes, nose, and mouth from splashes. These are the minimum required PPE for potential blood exposure during cleanup. Question 7. A patient presents with symptoms of a urinary tract infection, UTI. The physician orders a clean catch midstream urine specimen. What instruction is most crucial for the medical assistant to give the patient to ensure an accurate specimen? Drink plenty of water before collecting the specimen. Collect the entire urine stream in the specimen cup. Begin urinating into the toilet, then stop and collect the middle portion. Refrigerate the specimen immediately after collection. The purpose of a clean catch midstream specimen is to obtain urine free from contamination by skin bacteria. Voiding a small amount into the toilet first flushes out contaminants before collecting the midstream portion, which is most representative of urine within the bladder and most accurate for diagnostic testing. Question 8. A medical assistant is setting up a sterile field for a minor surgical procedure. Which action would immediately contaminate the sterile field? Placing sterile instruments within 1 inch of the edge of the sterile drape. Turning away from the sterile field to retrieve additional supplies. Reaching over the sterile field to adjust the overhead light. Touching the inner surface of the sterile glove with a non-gloved hand. Reaching over a sterile field, even without touching it, is considered contamination because dust, lint, or microbes from the non-sterile arm or clothing can fall onto the sterile area. The sterile field is considered sterile only from the waist level up and in front of the medical assistant. Question 9. A patient is scheduled for a pulmonary function test, PFT. The medical assistant should instruct the patient to avoid which of the following before the test? Eating a light breakfast, drinking water, taking bronchodilators, wearing loose-fitting clothing. PFT measures lung capacity and airflow, requiring assessment of baseline lung function without medication influence. Bronchodilators open airways and would alter test results, making them inaccurate for assessing underlying lung conditions. Patients should temporarily stop bronchodilators before PFTs unless otherwise instructed by the physician. Question 10. During a routine venipuncture, a medical assistant accidentally punctures their own finger with a contaminated needle. What is the first and most critical action the medical assistant should take? Immediately report the incident to their supervisor. Wash the puncture site thoroughly with soap and water. Apply an antiseptic to the wound and bandage it. Go to the emergency room for a bloodborne pathogen panel. The immediate action after a needle stick injury is to clean the wound thoroughly to remove as many potential pathogens as possible. Washing with soap and water physically removes blood and contaminants, significantly reducing infection risk. While reporting and medical follow-up are necessary, washing is the immediate priority. Question 11. A medical assistant is documenting a patient's vital signs in the electronic health record, EHR. The patient's oral temperature is 100.2 degrees Fahrenheit, 37.9 degrees Celsius. Pulse is 98 BPM. Respirations are 20 breaths/min, and blood pressure is 130/85 mmHg. The patient states they have a mild headache. What action is most appropriate regarding the documentation of the headache? Document the headache under the subjective section of the SOAP note. Document the headache under the objective section of the SOAP note. Do not document the headache as it is not a vital sign. Inform the patient that their headache is likely due to their slightly elevated temperature. Information directly reported by the patient falls under subjective data. The SOAP format places what the patient tells you about their symptoms in the subjective section. Objective data includes measurable facts like vital signs. The patient's statement about their headache is subjective and belongs there. Question 12. A physician orders a complete blood count, CBC, and a prothrombin time, PT/INR, for a patient. In what order should the medical assistant draw the blood tubes? Light blue, then lavender. Lavender, then light blue. Red, then light blue, then lavender. Light blue, then green, then lavender. Light blue top tubes contain sodium citrate for coagulation studies like PT/INR and must be drawn first to prevent contamination by other additives. Lavender top tubes contain EDTA for hematology tests like CBC and should be drawn after. Following the correct order of draw prevents additive carryover. Question 13. A medical assistant is discussing medication reconciliation with a new patient. The patient provides a list of their current medications, but one medication is listed with 2 different dosages by 2 different pharmacies. What is the most appropriate action for the medical assistant to take? Record both dosages as listed by the patient. Instruct the patient to call their previous physician for clarification. Contact the prescribing physician's office to clarify the correct dosage. Advise the patient to take the lower of the 2 dosages to be safe. A discrepancy in medication dosage represents a potential medication error or confusion that could harm the patient. The most appropriate action is to directly clarify the correct dosage with the prescribing physician's office to ensure accuracy and patient safety. Medical assistants are not authorized to make clinical judgments about dosages. Question 14. A medical assistant is performing an EKG. The tracing shows a wandering baseline. Which of the following is the most likely cause? Patient movement or loose electrodes? Electrical interference from other equipment? Dry electrodes or expired gel? Inaccurate lead placement? A wandering baseline is characterized by the baseline moving up and down the EKG paper, making interpretation difficult. The most common cause is patient movement, talking, shivering, breathing, or loose electrodes not making good skin contact. Ensuring the patient is still and electrodes are secure often resolves this issue. Question 15. A medical assistant is scheduling an appointment for a patient who frequently cancels or no-shows. What is the most appropriate action to take to manage this patient scheduling? Schedule the patient for the most popular appointment time slots. Advise the patient that they will be discharged from the practice if they miss another appointment. Discuss the importance of keeping appointments and document the conversation. Schedule the patient at the end of the day to minimize disruption if they no-show. Direct, professional communication focusing on education is the first step in managing problematic scheduling behavior. Discussing the importance of keeping appointments and explaining the impact on health and clinic schedule is crucial. Documenting the conversation ensures a record of the interaction and establishes clear expectations. Question 16. A medical assistant is educating a patient about collecting a 24-hour urine specimen. Which of the following instructions is essential for the medical assistant to include? Discard the first urine voided in the morning on day 1. Collect only the urine voided during daylight hours. Add a preservative tablet to the collection container immediately. Refrigerate the urine collection container between voidings. The first void of the collection period is discarded because it represents urine produced before the start of the 24-hour period. All subsequent urine for the next 24 hours is collected, including the first void of the next day. This ensures accurate measurement of substances over a full day. Question 17. A medical assistant is preparing a patient for a sigmoidoscopy. Which position is most appropriate for this procedure? Supine position, Fowler's position, lithotomy position, Sims position. The Sims position, left lateral with right leg flexed more sharply than the left, allows optimal visualization and access to the rectum and sigmoid colon while providing patient comfort and modesty. This position is commonly used for rectal and sigmoid examinations. Question 18. A medical assistant is preparing to perform a capillary puncture on an infant for a blood glucose test. Which of the following sites is most appropriate? The fleshy pad of the thumb, the central plantar surface of the heel, the tip of the great toe, the lateral side of the third finger. For infants, typically under 1 year, the lateral or medial plantar surfaces of the heel are preferred because these areas have less risk of bone injury compared to the central heel or toes. Finger sticks are not recommended for infants due to the risk of bone damage. Question 19. A medical assistant receives an urgent call from a patient reporting symptoms of a severe allergic reaction after taking a new medication. The patient sounds distressed and asks for immediate advice. What is the first and most critical action the medical assistant should take? Instruct the patient to go to the nearest emergency room immediately. Advise the patient to take an over-the-counter antihistamine. Ask the patient to describe their symptoms in detail and then put them on hold to contact the physician. Schedule an urgent same-day appointment for the patient to be seen by the physician. A severe allergic reaction can rapidly become life-threatening and requires immediate emergency care. The medical assistant cannot diagnose or prescribe over the phone. Directing the patient to the nearest ER is the most appropriate action to ensure they receive prompt professional medical intervention. Question 20. A medical assistant is preparing an immunization for a 6-month-old infant. Which injection site is most appropriate for this age group? Deltoid muscle, dorsogluteal muscle, ventrogluteal muscle, vastus lateralis muscle. For infants aged 0 to 12 months, the vastus lateralis, outer thigh, is the safest and most appropriate site for IM injections. This muscle is well developed in infants, provides a large muscle mass for absorption, and has minimal risk of hitting nerves or blood vessels. Other sites are too small or carry higher risk for this age group. Question 21. A patient with a history of hypertension is prescribed a new diuretic. The medical assistant is providing education on potential side effects. Which of the following is a common side effect of diuretics that the patient should be aware of? Constipation, weight gain, increased urination, drowsiness. Diuretics, water pills, work by increasing excretion of water and salt through the kidneys, making increased urination a direct and common side effect. Patients need to understand this to know why they are urinating more frequently and to ensure adequate hydration to prevent excessive fluid loss. Question 22. A medical assistant is performing a Holter monitor application. What is the most important instruction to give the patient regarding their activities during the monitoring period? Avoid showering or bathing to keep the electrodes dry. Refrain from vigorous exercise to prevent dislodging electrodes. Keep a detailed diary of symptoms, activities, and emotional states. Limit caffeine and nicotine intake to prevent arrhythmias. The primary purpose of the Holter monitor is to correlate recorded cardiac events with the patient's symptoms, activities, and emotional states. Without a detailed diary, the physician has only raw data, making it difficult to link heart rhythm changes to the patient's experiences. The diary is crucial for interpretation. Question 23. A medical assistant is preparing an autoclave for sterilization. Which item should not be placed in the autoclave for sterilization? Surgical instruments, heat-sensitive plastic tubing, fabric dressings, glass syringes. An autoclave uses high-pressure steam at high temperatures. Heat-sensitive plastic tubing would likely melt, deform, or be damaged by the intense heat and steam, rendering it unsterile or unusable. Other methods, such as chemical sterilization, are used for heat-sensitive items. Question 24. A medical assistant is educating a patient about proper crutch usage. The patient asks how to determine the correct crutch height. What is the most accurate instruction? The top of the crutches should be directly in the armpit. There should be a 1-inch space between the axilla and the top of the crutch. The hand grips should be at hip level. The elbows should be fully extended when grasping the hand grips. A 1-inch gap between the top of the crutch and the axilla prevents pressure on the brachial plexus nerves and blood vessels, which can lead to nerve damage or crutch paralysis. The patient should bear weight through their hands, not their armpits. This space is crucial for safe crutch use.